Hey everybody, Suzanne here with Patient Best and Caregiver Haven. Hey, today we've got a really exciting webinar for you. It's on high blood pressure. In other words, it's on hypertension. Those are two words that go together. They mean the same thing. So many Americans suffer from high blood pressure and they worry about their heart because of it. So we're going to look at that. We're going to look at several other things as well. So let's get started. First of all, let's look at the definition of high blood pressure or hypertension. And then let's look at what it does and how it affects the heart and what we mean by heart disease and hypertension. We'll look at some of the causes, and then we're going to learn how to take our blood pressure correctly because blood pressure is a constant moving target. Then we're going to talk about controlling our blood pressure with medications, and we're going to go over the different types of medications and why your doctor has you on them. And then we're going to talk about controlling your blood pressure without medications. But we're also going to talk about not only the medications your doctor has you on, but why they have you on different ones. Isn't one enough to do the job? We'll talk about that. And the side effect of these medications so that you can intelligently talk to your physician if you want to eventually get off some of these medications. So let's see where we're at right now. Okay, the first thing we want to look at is the connection between high blood pressure and the heart. The heart is a pump. And what we don't want is, as the blood is going through the pump, being the heart, we don't want the pipes to burst. And the pipes, I want you to think of as the blood vessels. We don't want them bursting. If they break open, we've got a problem. We're going to lose all our blood. But the other way something can go wrong is if they start to clot and they get jammed up. We don't have an automatic plunger that goes in and cleans out our blood vessels like we do our plumbing. So that pump is going to have to start working harder, and it will or it will not. So it's extremely important that we look at blood pressure or hypertension in the blood vessels because we're looking also at protecting the pump that pushes this pressure through. This is all based on pressure. So let's look at the blood pressure and what that means for you. There are several different kinds. What we hope for is to get your blood pressure somewhere around the 120/80 mark. The top number meaning that when the heart squeezes or pumps, the pressure gets up as high as 120. And when the heart is now resting, or the pump is just resting, there's still pressure in the pipes or the blood vessels, and that's around 80 or less. That's normal blood pressure. Then we get into an elevated blood pressure. Doesn't necessarily mean that you have high blood pressure. It means it's just elevated. And that's the second numbers here, the 120/129 and under over, I'm sorry, 120 to 129/80 or less than 80. Then we get into the stage 1 hypertension. Okay, this is where you have what's considered a chronic disease that can be managed. And that's where your blood pressure consistently, at least 3 times in the doctor's office, when they take your blood pressure, it ranges from 130 to 139 for the top and 80 to 89 for the bottom. Then we get into hypertension stage 2, which is the 140 plus and the not over the 90 plus. And then we have a hypertensive crisis. Something I have seen in the emergency room is the 180 plus over 120. It was nothing uncommon for me to see, 200, 210 over 140, 160, 180. Very always concerned about that bottom number because that bottom number says that the heart's at rest and the pressure is still that high, 180 or 190 in the bottom number. The pressure is that high in the blood vessels. So that's pretty frightening because that means those blood vessels are taking an awful lot of pressure and wear and tear. So that's what those numbers mean and why your doctor wants to get them down, especially what we call the hypertensive crisis, the bottom number. All right, let's look at the heart disease and hypertension. What's one of the problems we have? It's called coronary artery disease. Coronary refers to heart. So this means those little vessels, the blue and the red ones that are coming down around the heart muscle. Obviously, muscle has to have oxygen, and the only way it's going to get oxygen is through the blood. So the heart has to pump blood not only in its whole body, your body, but it also has to pump the blood into the heart muscle itself so it can stay alive and work effectively. That's the coronary arteries and veins, the little babies there that carry the oxygen to the heart muscle. So if we have increased blood pressure there, this can cause a narrowing of these arteries, and that's called atherosclerosis. And it's going to restrict blood flow to the heart muscle. And over time, when this blood flow is reduced, we get coronary artery disease, also known as plaque buildup in the coronary arteries, which of course lead to a heart attack because the heart muscle is no longer getting oxygen. It's also can be called angina, which means chest pain. And also, there can be, of course, other complications. So, we want to make sure those coronary arteries, those little arteries, are always open and in good working order. The pipes are clean. The other thing we're going to look at is that prolonged high blood pressure forces the heart to work harder to pump the blood through the body. Because remember, a pump also has to have higher blood pressure than the vessel it's pumping into or the pipe it's pumping into. If it has a lower pressure, nothing's going to move. And our circulation system is a one-way system. It starts at the heart and it stays going one way. It's got to pump hard enough to move the blood through those vessels. So after a while, the heart is going to start tiring out. And this is hypertensive heart disease. And it might mean an enlargement of the left ventricle of the heart. It could mean heart failure. It could even mean heart rhythm abnormalities called arrhythmias, because over time, the untreated hypertensive heart weakens. The heart muscle weakens and the heart just gets fatigued. So we want to be careful and mindful to keep our blood pressure down so we don't weaken our heart. After all, we only have one pump, and so we have to go with it. Next, we're going to look at the risk of stroke. Now, the risk of stroke and peripheral artery disease does not affect, we're not talking about the heart, but we're talking about outside the heart. We're talking about in the body, but outside the heart. So it's a significant factor for stroke. And we already saw that back in that slide back here, where I talked about you get too much pressure, the pipes are going to burst. That's one thing. But we're also looking at peripheral artery disease right here. There are basically two types of strokes that I saw in the emergency room. One of them was the pipe breaking and bursting. The other one is a clot. And when you have a clot, in both things, what happens is blood can't get past the clot up here in the brain, but down here, even blood can't get past the burst, I should say, in the brain if the pipes burst. Also, blood can't get past a clot either. So the effect is the same, basically. Whether you have bursted pipes or you have a clot in the pipe, it doesn't matter. Blood and oxygen is not going to get there. With peripheral artery disease, as most of you know, you have plaque buildup. It narrows the arteries. The blood is reduced in flow. And in the lower extremities, you're getting leg pain and cramping and difficulty walking. This is what people suffer from when they have these. So again, high blood pressure, we want to get that blood flowing nicely and not breaking or clogging these pipes. Hope that makes sense. Okay, next thing we want to look at is the pumping. The heart is pumping directly proportional to its ability to get the blood to the tissues. Now, if we didn't have live tissue on our body, we would have decaying tissue on our body and we would start to smell like decaying bodies. But fortunately, regardless of the size that we are, we do have blood vessels, roads, if you will, pipes, if you will, that are getting to our live tissues. Whether we weigh, let's say, 170 pounds, like the guy in the black t shirt, or whether he weighs 230, 50 pounds in the red t shirt. But both of them have to have oxygen and blood to supply their tissues. And this includes their fat tissues as well as their muscle tissues, their nervous tissues, their connective tissues. So, what happens when the guy in the black shirt has gained 50 pounds and he's the guy in the red shirt? Does he have to grow more pipes, more roads to get the blood to his fat tissues now? Yes, he does. How much more strain is that going to put on the pump now that they're still the same pump? It just has to pump more miles of blood pressure. I hope this makes sense. Because when we start losing weight, those miles just disintegrate. We don't have that many miles of vessels anymore. They just don't need to be there anymore. And the body knows this. So the body doesn't have to pump as hard. So the high blood pressure that you're seeing might be due to your weight. And we're going to talk a little bit more about that. So think about the blood vessels. If you have a good old country town that has one road that goes down Main Street, no problem. Easy traffic. But when you get a large city with lots of roads, now you've got a budget. Now you've got to start paying for the underpasses, overpasses, the highways, the trucks that are on it, all the damage that's going to be done, everything else that goes with a pipe or a road map or a highway. Okay. So what we're trying to do is get down to a good, healthy weight. All right, the next thing we have to look at is for a cause is not only weight, but we have to look at the unhealthy diet that we have. And in America, unfortunately, most people eat quick meals and they don't think about what they're eating. Unfortunately, poor dietary habits like consuming high amounts of sodium or salt. There's even salt in not only on French fries, but sugar on French fries to make them sweeter. And we certainly don't need sugar. If we stay away from sugar, we're going to lose weight. We then have saturated fats, and all of this, including cholesterol, causes high or increased blood pressure. There's a rule of thumb that you might want to pay attention to, and that is where salt goes, water goes. So water will always follow salt. So if you go buy a bag of potato chips and sit down on the couch and watch TV and have eaten that whole bag of potato chips, you're going to have some swelling the next day. Why? Because no matter how much water you drink, there's a lot of sodium now or salt in your blood, and where salt goes, water goes. So your water is going to be in your blood as well. More water in the blood means the heart has to pump harder to get the volume of blood now down into the pipes. I hope this makes sense. So where salt goes, water will follow. So we want to cut out the salt or the sodium chloride, it's called, so we can better regulate our blood pressure. Processed foods, fast foods, high sodium condiments, especially like ketchup, right, has salt and sugar in it. They all need to go. The other thing we got to look at that can cause it is the lack of physical activity. Sitting in front of a computer all day or in front of the TV all day just doesn't cut it. We know we have to get up and move. So why do we have to get up and move? What's the big deal about moving? Why do we always have to be on the go? Well, if you remember ever took a quick anatomy class, the blood vessels run through the muscles, between muscles. Muscles help move that flow. The muscles, think about it this way. If you stand on your tippy toes and stretch out your calves of your legs, those muscles, those calf muscles, are actually helping the blood flow to your feet. And many times people with a peripheral artery disease will move their feet back and forth a lot. Why? Because they want those calf muscles to help get that blood down to the feet. That's what muscles do. Muscles are important. They do a lot of other things, but they're extremely important in getting our blood to flow to our limbs. That's the last place that the heart's thinking about. The heart is thinking about getting our blood to the abdominal organs and to the brain, of course. But when her fingers get cold or her toes get cold, we might want to start stimulating some muscle to help get the blood to flow to those extremities. Next is stress. It increases the heart rate and it can restrict blood. There's a lot of anxiety going on in America today. And when we're stressed, the body releases hormones like adrenaline and cortisol. This temporarily increases the heart rate. And worse, it constricts blood vessels. While this response is natural in the short term, prolonged stress is going to lead to persistent elevation of blood pressure. And managing this is done through relaxation techniques, of course, and regular exercise and coping, healthy coping mechanisms that we can do in order to get rid of this kind of pressure that we see over and over again. So, stress, how do we get rid of it? What can we do? We know there are techniques out there. Okay, next, we have to look at the genetic factors. Sometimes we just can't help what our parents give us. And there's enough said there, genetically predisposed to high blood pressure because mom and dad had it. Now, there's also something, though, called the placebo effect. It's 40% effective. It says, gosh, I'm growing up, mom and dad both have a high blood pressure. That means I'm going to have it too. And we have to look at that and say, wait a minute, maybe if we put in a good diet, we release the stress in our lives, and we get out and start moving our muscles, we might not have to live with high blood pressure. We might not have to buy into it. So think about genetics in a different way. Are there things you can do? We now know there is. Let's talk about taking your blood pressure correctly, because I got to tell you, I have seen the craziest ways that people take blood pressure that I just roll my eyes. First of all, blood pressure changes by the hour, by the minute, by the day, by the week, by the months of the year. Blood pressure will change in the morning, afternoon, and evening. Do not think your blood pressure is going to be the same all the time. You take an average. You cannot predict why 1 minute it's up, next minute it's down. We can try to figure it out, but we never know. Things like medication is going to change it. Food is going to change it. Stress is going to change it. Lack of exercise is going to change it. All of these things. So it's constantly moving up and down. Do not expect it to be the same at all times. But let's look, speaking of timing, when do we take our blood pressure? Do you take it every day? If you're taking it, I have a worksheet where I want you to keep track of it. Basically, what we're doing, click on this worksheet and it goes into a bit of detail on how you take your blood pressure. And then you take your blood pressure journal or this tracker into your doctor and you say, look at my numbers here. Are they good? Are they bad? Are they ugly? Do you need to readjust my medications? So if I'm normally high in the evenings, maybe I need to take my blood pressure medicine a little later on in the day. Maybe it's too low and I'm taking my blood pressure medicine when my blood pressure is already too low. And that's why I feel fatigued and bottomed out and I don't feel good and I don't want to take it anymore. Maybe we need to adjust it because blood pressure will go up and down throughout the day. Good news is it typically has a pattern. Your blood pressure is sometimes the highest. Everybody's different. Some people have high blood pressure only in the evenings. Sometimes their blood pressure is highest in the morning. Everybody's different. So that's what this tracker does. It looks at when is your blood pressure typically the highest, when is it typically the lowest, so your medications can be adjusted accordingly. So you take it at sunrise, sunset. Do you take it before you eat, after you eat? An interesting story here. I had a patient come in once who had his blood pressure taken. He said, when he gets home from work. And I said, how's that working out for you? And he says, I am a basket case because my wife is standing at the door every night when I come through the garage with the blood pressure cuff. And I know she's going to be there standing there with it. And it's going to be high. And there's nothing I can do about it because she's making my blood pressure go up. Well, he's absolutely right. If we know we're going to have our blood pressure taken, like many of us go to the doctor and we have what's called white coat syndrome. We know we're going to get our blood pressure taken, so it goes up. That's just something that happens. That's called the stress factor there. We can't help it. We know they're going to take our blood pressure. What I have done, because it personally happens to me now, is I take my blood pressure at home. I keep a tracker. Then I take that in to my doctor and I say, don't be taking my blood pressure. I've got it right here. And if they say they have to take my blood pressure, I have them first, the medical assistant takes it. It's typically higher. And then once I've relaxed, or I'm almost done with my visit, they take it again and it's always lower. And I said, record that number in my chart. Do not record the higher number. I do not have high blood pressure. I want the lowest number possible. Because what they're going to do is they're going to keep dumping more medicines on you if they don't realize, wait a minute, one time doesn't catch it. We have to take it several times. So I always have them only record the number at the end, or I convince them to look at my chart and pick a number from that or an average. Okay, next thing is location. So why do I have a dog without a leash looking over a cliff? Because this makes me a nervous wreck. And many times, as I said, we can't take our blood pressure when we're nervous. We can't take our blood pressure after we've had a fight or something like that with someone. That's not a good time. So location is extremely important. Like the doctor's office is going to raise it. Standing over a cliff, we don't want to take our blood pressure. But the human element to this is we don't want to take our blood pressure on a bad limb. Are you taking it on the left arm? Are you taking it on the right arm? Why is it different? Because your blood pressure comes out of the heart from two different arteries, one that goes to the right and one that goes to the left. So stay consistent here. So not only do you have to look at location where you're taking your blood pressure in terms of home or on a cliff or in a doctor's office, but you also have to look at it in terms of left arm or right arm. I hope this makes sense. Blood pressure can be very tricky. That's why so many people cannot seem to capture a good number on it. Okay, let's understand our medications because there are tons of medications out there. And people used to come to me and say, my patients, and they would say, you know, I worked urgent care, I worked emergency room, I did internal medicine, I did family practice too. And the patients would say, why are you putting me on another medication for blood pressure? Don't you know what you're doing? And some patients would come in and say, I'm on 4 different medications for blood pressure. This is ridiculous. The doctor doesn't know what he or she is doing. And I'd say, no, hold up. These medications all do different things because there's so many reasons why blood pressure can be high. So we've got to control all of them because we have one heart. Everything leads back to the heart. So I'm gonna delve into each and every one of these so you get an idea of understanding why you're on different blood pressure medicines and what your doctor is actually trying to do. The first one we're going to look at are diuretics. So diuretics, you're going to pee a lot. Diuretics is getting rid of the excess water. And where water goes, what goes? I already told you, sodium or salt. So therefore, we want to get rid of the water. That means the pipes aren't as full anymore. The heart can relax. The pump can just pump nicely. Okay? That's hydrochlorothiazide, maybe Lasix or furosemide are the medications you would know for this. Now, some of these drugs may decrease also your body's potassium. So you might find some weakness, leg cramps, you might be tired. That can also be a problem. All right, you might take diuretics and you can increase the risk of developing gout if you've had gout before. And while it isn't common, your blood pressure can be managed by other treatments. Another thing is with people with diabetes, well, if we're taking out all the water, then their sugar level is obviously going to go up because sugar is diluted into the water. So we take out the water. Now we got a high concentration of sugar. All right. So this can kind of mislead your physician in terms of how well your sugar levels are doing or your A1C is doing. So in this case, what you might want to do is if somebody like your heart doctor has put you on a diuretic and you have and you have diabetes, you want to let your primary care or who's ever handling your diabetes know this because it might constitute a problem. Totally something that your doctor has to decide. The other thing it might happen is you might have impotence. So, not having an erection might be a problem if you're on a diuretic. Again, we need fluids for that to occur. Okay, the next one is going to be beta blockers. And beta blockers typically end in an LOL. So if your medication has an LOL, laugh out loud, is not really what it stands for. It's just LOL. What this is doing is beta blockers are basically reducing the heart rate and the heart's workload. And it's telling the heart to just kind of slow down. This will lower the blood pressure. But some of the side effects you might have is insomnia, and there might even be some sleep changes or nightmares. You might have constipation. You may have tiredness or depression. You may have dizziness. You may have a slow heartbeat, but that's because that's what the beta blocker is supposed to do. Symptoms of asthma, sexual or erectile dysfunction of some kind, and maybe even a heart block, which is rare. But we look at beta blockers to see if you come in with any of these symptoms. And of course, again, if you have diabetes and you're taking insulin, we got to make sure the insulin is spread through your blood. And so we're going to monitor these beta blockers real carefully. Next thing we're going to look at are the ACE inhibitors. They tend to end in PRIL if you are taking any medication with those. The ACE inhibitors it's basically going to cause the arteries to open back up again because there is a chemical in your body that makes them become narrow. And what we want to do is we want to open them back up. We want big, wide open roads. We don't want everybody merging. We want to keep the roads nice and wide. We want a 15-lane highway. We don't want a 1-lane highway. Okay. And this way, the traffic moves, the blood moves through nicely, and everybody gets to where they need to go in a quick fashion. Okay. So this is what the ACE inhibitor does. It is going to open up these blood vessels and subsequently lower the heart pump so it doesn't have to pump as hard. Some things you might get with this is a chronic dry hacking cough, dizziness, fainting. You might have high potassium. Your blood pressure might get too low if we open up your blood vessels too quickly or too much. Sometimes you might even get some kidney damage with it. The next ones are called the ARBs. Well, these are the angiotensin converting enzyme inhibitors, the ACE inhibitors. The next ones are the ARBs, angiotensin 2 receptor blockers. And what that means is they end in a -TAN. So if you see a medicine you're on that ends in a TAN, what we have just done here is basically the same thing as the ACE inhibitors. We've opened up the highway. We built another highway and we've widened it so that everybody the blood can get where it wants to go. But some of the things you'll notice here is you also have dizziness and kidney damage. You might even have low potassium. Your blood pressure could get too low. They're not used during pregnancy, but for seniors, I don't think we need to worry about that. So we'll move on. Calcium channel blockers, they tend to end in the PINE. And these are important because they relax and open up the narrowed blood vessels as well. They reduce the heart rate and they lower the blood pressure when they do this. So some of the things you'll see here are swollen ankles, constipation, headaches, and dizziness. that occurs with calcium channel blockers. But all these things are hitting different receptors within the blood vessels to make them open wider, wider, wider. The ACE inhibitors, the ARBs, and the calcium channel blockers. Now we have something called alpha blockers. They tend to end in the OSIN. And these are the guys that are going to tell the artery muscle walls to relax, get a grip, calm down, stop being so stressed. It actually works not on widening, it works on relaxing the muscle tone of the vascular walls or the pipes. Okay. It says just take a big sigh and just keep breathing. Some of the things you'll get here, though, is you might get a fast heart rate, and dizziness, low blood pressure, which of course is what we want, but not real low, weakness, and maybe even some trembling. So that's another category. And then a few others to mention here, finally, at the end of all this, is sometimes you get a combination, or we have a certain blood pressure just for pregnant women. Then we have a combination of the alpha and beta blockers for people who might have heart failure. Corig is a good one for this. Or in the emergency room, we're throwing everything at folks to get their blood pressure down if they're in a hypertensive crisis. And so we'll throw alpha and beta blockers at them in combination. And then we also have blood vessel dilators that work differently than the other vasodilators that relax and open up the roadways. And that's called hydralazine. And many people I have seen are on this drug as well. All right, so let's look at this. How your doctors have you take your medicines is extremely important. What your doctor is trying to do is regulate your blood pressure by monitoring the number of times you have to take the medication. They're looking at how long it stays in your system. They're looking at the strength of the medication, and they're looking at the side effects of the medication. They don't want you walking around tired all day long. They want you to take your medication when your blood pressure is high, again, so you're not taking it when your blood pressure is the lowest time of the day, because if you do it at the lowest time of the day, when your blood pressure is typically low, and that's something you've got to figure out, with a tracker. But if you're taking it when you're low, then it's even going to get lower, and you're going to feel fatigued, and you're going to feel like a zombie. So you don't want to do that. So they've got to use the strength of the medication. They've got to look at the life of the medication, how long it stays in your system. Is it short acting? Is it long acting? What type of medication, what it's supposed to do, and the time you're going to take it. All of this is how your doctor, and I love it because what they do is basically a mental gymnastics. They are thinking about, as you're sitting in front of them, they are going through all the steps in their head, 1, 2, 3. You don't even know they're doing this while they're rearranging your blood pressure medications so that you get it under control. That's what they want to do. All right. Let's control your blood pressure without medications. Obviously, you never go off your medication. You have to have your doctors as a guide in order to help you. So all hands on deck here. What are we going to do? Well, first of all, you're going to lose weight. If you can get rid of those extra roadways through all the fat tissues and you can lose weight, woohoo, your heart will love you for it. They don't have to pump to those extra miles of road anymore to get the oxygen to your fat tissues. So get rid of those miles of blood vessels. All right. The second thing you need to do is, well, I said, lose the fat, not the muscle. The other thing is you want to gain muscle, but one thing at a time. First, lose the fat tissue, and then gain the muscle, because the muscle is going to help the blood flow through to the fingers and the toes, the nose, whatever. It's going to help so much better. Now, here's where, at the time of this writing, I'm currently putting together the program my father used back in the 1960s as a family practice physician to help his patients lose weight. It's the same program I'm using today. I've already lost 40 pounds and I'm still losing weight, but I'm gaining muscle. And how I'm doing that is there's several techniques. And when I get this product out, if you're interested in it, just keep watch in the emails because it will be there and you can see what I have done and you can follow the same. It is so simple. It is so stupid. And everybody I talk to that has done this program is like, I can't believe it's this easy. And it is. So several things, but first and foremost, we're going to lose the fat tissue, not the muscle. Muscle weighs more than fat, so you don't even need a scale. Scales are obsolete. That is stupid to be weighing ourselves. What we need to do is we need to look at the clothes we're wearing. Are they getting looser? That's what we want. Clothes are the real telling, not the weight. Okay. I'll get off that because there's so much to talk about there. The other thing is we're going to start moving. I don't care how you move, just move. If it means parking your car in the farthest lot in the parking lot and walking to the store, if it means going to the bathroom that's the farthest away from where you currently are in your home, or you have to go upstairs to go to the bathroom, do it. Start moving those muscles. Build the muscles. They act as a promoter to the blood flow. And we talked about that. We talked about standing on your tippy toes and stretching those calf muscles and what that does. This is why walking is so good for you because you're using all your muscles to get that blood flowing. It doesn't mean you have to run a marathon. It just means you have to get your muscles to help move the blood. That relaxes the heart. The heart doesn't have to work as hard. Therefore, you won't have heart disease. All right. And the other thing you have to do is you got to relax. Now, I know this guy's relaxing, but, and I could tell you he probably should move some more. But you know what? It's time to relax. There's a time for everything, right? There's a season for all. So there's a time to get up and start moving, and there's a time to relax. So get rid of the stress. Put your mind on something else that you enjoy and get off the stress that you live with. So that's extremely important. And when you do this, not only do you get rid of some of this stress and you release it from your mind and you think better, but you also bring down your cortisol levels. That hormone that causes us to fight or flight, you bring down the cortisol level, which remember back, I told you it restricts blood vessels. Well, how about if we get it down? All right. So it also cortisol manages your carbohydrates, fats, and proteins. It does help regulate your blood pressure, all right? But it can also increase your blood pressure. Your blood sugar. So you want to get it down. So those are things we want to know our cortisol level is not stressed chronically. So what did we learn today? Well, we learned the definition of high blood pressure or hypertension is the pressure in our blood vessels. We learned how the high blood pressure in our blood vessels or pipes make the pump, work harder. And when the pump has to work harder, it leads to heart weakening or heart failure. It leads to arrhythmias. And then we talked about the causes and things like our diet, not exercising, and the stress in our lives. I'll also add here that alcohol needs to be done in moderation if you do drink, because number one, these mixed drinks have a lot of sugar in them. And number two, when you drink alcohol, it can affect your blood pressure, make it go up, actually. So we also learned about taking your blood pressure correctly. Don't take it after a fight. You take it, look at the tracker and take your blood pressure the way I suggest in the tracker, and then take that to your doctor and discuss when the best time is for you to take your medications. And then we talked about the different medications and what they do and what their side effects are. So if you're feeling any of those side effects we talked about, then go ahead and get list together for your doctor and talk about which medications you think might be causing which side effects. And then controlling your blood pressure without medications. Lose the weight. I mean, it's the truth. It's a fact. You lose weight, your blood pressure will go down. It absolutely will. It just doesn't have that many roads or pipes that it has to pump to anymore. So those are all the good things about it. So I hope you learned a lot here in this webinar, and I'll leave the information and the worksheets below so you'll have those. And let me know if you have any questions. But always check with your doctor first. Don't ever change anything unless you've talked to them. Take care. Bye bye.